Am I visible, audible to you people? Let me confirm if I am clearly visible, audible to you people. I will start the lecture ahead. Give me a second for confirmation. Soon I will start the lecture. Few seconds more. Okay. So yeah, I hope it is working and I am visible and audible to you people. So very good morning to all of you. I welcome you all for today's session. I am Dr. Priyanka Sachdev here and today I am here to teach you the spotters in pathology. So yesterday we have started the spotters in pathology and today I will continue it. So spotters in pathology are basically for the practicals. Just give me a second. Let me skip. Yeah. It is for the practical exams for second prof MBBS students who are going to attempt their university exam this year. So in the university exam, you have theory paper 1, theory paper 2, and you have your practicals in pathology. So in practicals, in pathology, for practicals and Viva, both I have launched this crash course. So in which I will tell you all spotters for the pathology. So in pathology, you get, most of the colleges get 10 spotters. Do your college also have 10 spotters or more? So please write down in the comment box. So in most of the colleges in India, I have seen that there are 10 spotters in your exam. So spotter can be a fluid, it can be an instrument, it can be a chart, it can be a hematology slide, it can be a histology slide, or it can be a museum specimen. You get 1 minute for one spotter. As you know, you have to identify the spotter, what it is, number one. And you have to answer one question, whatever is asked in that spotter. So if it is a fluid, we will ask you the composition and use. If it is an instrument, we will ask you two uses. If it is a hematology slide, we will ask you to identify the cell which is at the pointer and write the causes of its rise and fall. So whatever question is written, you have to answer that in 1 minute with correct spelling. Only one word you have to write with correct spelling. So you don't have to do spelling mistake. So 10 spotters, 10 marks, and if you read it correctly, attempt it correctly, you will get 10 out of 10. So it is a good opportunity in practicals to get 10 out of 10, right? Okay. After that, you have 5 exercises. We will discuss the 5 exercises also in detail. And you have 5 table vivas. Yes or no? You all have 5 table vivas. So we will discuss the table viva questions from each of these exercises in detail. First, let me cover the spotting. After that, I will cover the exercises also. Urine exercise, hemoglobin exercise, Sahali's hemoglobinometer, blood group wala exercise, DLC wala exercise, and histology slide with a history is given to you. That is the practical exercises. After that, you have a grand viva. The grand viva can go anywhere, on any instrument, on any fluid, on any specimen, on any chart, on any card. So there is a table in front of you and you have everything in front of you. So examiner can ask you anything from the entire pathology, but there are few important topics on which usually grand viva goes. So I will help you in teaching, in studying, in understanding those topics also. So let me start with spotting. In spotting, let me start with fluids and instruments. So yesterday we have, so I am having total 15 or 17 instruments with me. So I will teach you all and the Viva for all. Viva for all also. It can come in your grand Viva also, right? So you have to identify and tell me the users, right? So yesterday we have started. So what is this instrument? Yesterday we have done. Are you people there? Yesterday, have you attended the lecture or you have watched the recording? What it is? It is Newbar's chamber. We have already seen it is Newbar's chamber. Newbar's chamber have two grid. There are two grids on one chamber. So two fluids can simultaneously we can examine on one Newbar. On one Newbar we can simultaneously examine two fluids. So grid जो होती है Newbar's chamber पे, see the spelling of Newbar. Spelling में you students do, you really most of the students do a big mistake in the spelling, and out of the one we will give 0 mark to you. So Newbar का spelling is little bit complicated, please learn it, right? You have to learn the dimensions of the grid. ये grid के dimensions क्या हैं? What are the dimensions? So yesterday I taught you total 9 chambers are there. It is divided into 9 squares. So peripheral 4 squares are for WBC, and it is divided each into 16, 16, 16, 16 squares, and central is for RBC. Central one is for RBC and it is divided into 25. It is divided into 25. I have told you this, right? And the depth here, whenever you keep fluid here and cover slip over it. So depth between the cover slip and the fluid, the depth here is 0.1. Depth here is 0.1, right? So each small scale, these are for WBC. Ye corner one are for WBC. Yesterday I taught you this. Corner one are for WBC. So WBC, one small square is 0.5 millimeter, because total it is 3. It is 3. So 3 में से this is 1, this is 1, this is 1. 1 millimeter, 1 millimeter, 1 millimeter. Now 1 millimeter is further divided into 4. Into 4. So 1 by 4 is 0.25. So that is how this figure 0.25 is coming. So 1, 1, 1, total 3 millimeter, 3 millimeter length, 3 millimeter width. So Newbar's chamber ka grid is a square. So it is like this. It is like this. So 3, 3. It is 3 millimeter, 3 millimeter. So from all the dimensions, it is 3, 3, 3, 3. 3 millimeter. It is a square. And it is divided into 9. So each one is 1, 1, 1, 1. If you talk about any of these square, it is 1 millimeter and 1 millimeter. So all of them are 1 millimeter, and the depth is 0.1 millimeter. That is the thing. So the corner one are WBC. ये चार WBC के हैं, ये चार WBC के हैं, and the central is RBC. So WBC ones are divided into 16 16 each. So 4 4 की grid बनेगी, 4 4 की grid बनेगी. So 1 upon, ये 1 है, 1 upon 4 it will be 0.25. और यहाँ पे 5 5 की grid बनेगी. टोटल 25 में हम डिवाइड करेंगे इसको, 25 में. So 25 में तो यहाँ के और each 25 वाला जो होगा स्मॉल वन, इट इज फर्दर डिवाइडेड इनटू 16. ये एक एक में 16 होंगे, ये एक एक में 16 होंगे. each 25 का 1 1 स्क्वायर. सो इट इज द स्मॉलेस्ट स्क्वायर. अगर आप लोगे तो इट इज 0.05. तो WBC का स्मॉलेस्ट स्क्वायर 0.25 और RBC का स्मॉलेस्ट स्क्वायर 0.05. दैट इज द समरी. दैट इज द समरी. एंड डेप्थ इज 0.1. So if you understood it, let me move ahead. So what are the uses? Newbar's chamber pe we can do 3 things: RBC count in blood, WBC count in blood, and sperm count in semen. So we can use either blood or semen. So we can spread here. यहाँ पे हम blood भी spread कर सकते हैं. Blood, if I spread blood here, so I can count RBC and WBC. And if I am spreading semen here, I can count the number of sperms in male semen. So that we can do. So these are the fluids we usually examine under Newbar's chamber, right? So in your syllabus, being MBBS student, only RBC and WBC count is there in your syllabus. So I will give you the details of these exercise, how we perform it. जिसपे आपका Viva जाता है. The next, I will come on that again. So for doing RBC count and WBC count apart from Newbar's chamber, we require 2 more things. RBC count के लिए we require RBC fluid. And WBC count के लिए we require WBC diluting fluid. So the two, and we require 2 pipettes also, RBC pipette and so let me finish fluid and pipette also, then I will tell you the complete exercise, right? So these are the 2 fluids in front of you. Can you see the 2 fluids? Yesterday I taught you the pink one. The pink one is RBC diluting fluid and the purple one is WBC diluting fluid. So looking at the color, you have to identify. Don't only identify, write their names also. So what is the name of RBC diluting fluid? It is known as Hayem's fluid, Hayem's fluid, or it is known as Desi. But Desi I have not seen in any college. In my college, in most of the college, students have Hayem's fluid. And WBC fluid ka naam hai Turk. It is known as Turk's fluid. So write both in your exam. If this is coming as a spotter, write both names. It is RBC diluting fluid, also known as Hayem's fluid. It is WBC diluting fluid, also known as Turk fluid. Then you will get 1 mark. So 1 mark के लिए तुम्हें दोनों नाम लिखने हैं. So the pink one and the purple one. Please learn the color. Do you have this in your college? Do you have Shrijit? Do you have this in your college or anyone else who is listening? Most of the students watch the recordings. Okay. So anyone, do you have these fluids in your college? I'm asking to you now. Please answer. So the pink one is RBC diluting fluid known as Hayem's fluid, and purple one is WBC diluting fluid known as Turk's fluid. Right? Okay. So Yashwant is saying, no, you don't have these fluids. But Yashwant, you never know. Whenever external comes for the exam, now they also bring some material with them for the spotting and for the Viva. So you never know, the Viva can go anywhere. So you should be prepared. At least it is there in your syllabus. You are a second prof student, Yashwant. So you should know about these fluids. So this Newbar's chamber to definitely hoga, Yashwant. यशवंत, न्यूबार्स चैम्बर तो होगा डेफिनेटली इन योर कॉलेज, यस और नो? सो अगर न्यूबार्स चैम्बर है तो वाइवा कैन गो ऑन दीज फ्लूइड. एग्जामिनर कैन आस्क यू अबाउट दीज फ्लूइड. यू शुड नो द कंपोजिशन ऑफ बोथ ऑफ देम. यस्टरडे आई हैव डिस्क्राइब्ड द कंपोजिशन ऑफ हेयम, मर्क्यूरी क्लोराइड, सोडियम सल्फेट एंड वाटर. एंड व्हाट अबाउट टर्क्स फ्लूइड? टर्क्स फ्लूइड का कंपोजिशन है ग्लेशियल एसिटिक एसिड एंड जेंशियन बॉयलेट एंड वाटर. तो वाटर तो दोनों में है. यहाँ पे ये 3 चीजें हैं, मर्क्यूरी क्लोराइड, सोडियम सल्फेट, और यहाँ पे एसिटिक एसिड और जेंशियन बॉयलेट. अपार्ट फ्रॉम इट वाटर तो दोनों में है. ओके, सो वी आर डन विद द 2 फ्लूइड्स आल्सो. वी आर डन विद द न्यूबार्स चैम्बर and we are done with RBC diluting fluid used for calculating RBC and WBC diluting fluid used for calculating WBC. But apart from Newbar's chamber is required for both. But we require two pipettes also, RBC pipette and WBC pipette. So can you identify the two pipettes? Can you see the two pipettes? How you will identify which is RBC pipette and which is WBC? Yashwant, Shrit, how you will identify which pipette it is? So looking at two things. Number one, bead. You have a bead inside the pipette and you have a marking. Look at two things, bead and marking. So you can see this is WBC pipette, have white color bead inside, and RBC pipette have red color bead. So see the color of the bead to identify the pipette, number one. And number two, see the marking. Both have 0.5 marking, both have 1 as a marking, and both have 11 or 101. So 11 is there in WBC. WBC में 11 है थर्ड मार्किंग और यहाँ पे 101 है थर्ड मार्किंग. So look the difference. 0.5 तो दोनों में है, 1 तो दोनों में है, लेकिन एक में 11 है, एक में 101 है. Give me a thumbs up. So this is how you have to identify the two pipettes. So WBC pipette are for calculating WBC and RBC pipette are for calculating RBC. अब इस पे क्या क्या क्वेश्चन आते हैं पहले तो आइडेंटिफाई करो. तो लुकिंग एट द बीड एंड मार्किंग, दो चीजें देखे यू कैन आइडेंटिफाई देम, बीड एंड मार्किंग. और पीछे भी देखो ये रेड कलर का होता है, ये व्हाइट कलर का होता है. इसके अंदर रेड बीड है, इसके अंदर व्हाइट बीड है और मार्किंग इज डिफरेंट. सो मार्किंग यहाँ पे आपको 101 मिलेगी, यहाँ पे आपको 11 मिलेगी. सो लुकिंग एट द बीड एंड मार्किंग. बीड का फंक्शन क्या है, ये आपका मोस्ट कॉमन वाइवा क्वेश्चन है. बीड का फंक्शन नॉट फॉर आइडेंटिफिकेशन बीड दिया है, बीड का फंक्शन फॉर मिक्सिंग है. हम मिक्स करेंगे, मैं अभी बताऊंगी. सो यू कैन सी द टू पिपेट्स. कैन यू सी द फर्स्ट वन, यहाँ पे 11 है, यहाँ पे मार्किंग 11 है, सो इट इज अ WBC पिपेट. एंड यहाँ पे मार्किंग 101 है, सो इट इज अ RBC पिपेट. So looking at the marking, now it can come in your spotter. So spotting में अगर कोई भी इसमें से pipette रखा हुआ है तो immediately take it in your hand, see the pipette, see the bead inside it and see the marking. So you will be able to identify. So write it down in your copy whether it is WBC pipette or RBC pipette. WBC pipette used for calculating WBCs and RBC pipette of course used for calculating RBCs in the blood. So yes, RBC for counting RBC and WBC for counting WBC. So the two pipettes are over. So let me now, till now what we have done, we have seen there is a Newbar's chamber used for both RBC count, WBC count. इसके अलावा तीसरा यूज है स्पर्म काउंट, जो तुम्हारे सिलेबस में नहीं है बट यू शुड नो स्पर्म काउंट. ह्यूमन मेल सीमन में स्पर्म काउंट के लिए, सो वेदर द ओलिगोस्पर्मिया इज देयर और एजोस्पर्मिया इज देयर और नॉट देयर. So we can use the Newbar's chamber, but the procedure is not in your syllabus. So only RBC count and WBC count in blood, we are using Newbar's chamber for MBBS syllabus. But there is a third use also, you should know it. After that, we have done the two fluids, RBC fluid, diluting fluid and WBC diluting fluid. And we have done the two pipettes, RBC pipette and WBC pipette. So how we calculate WBC? First tell me. WBC के लिए I will use three materials, these three materials. And for calculating RBC, I will use three materials. So Newbar is common for both, right? So let me start with WBC. Are you people there? Let me start with WBC count procedure. Give me a thumbs up in the chat box. So how we do? This is all for your Viva, huh? So Viva में, grand Viva में, when you sit in front of examiner, the examiner can ask you to take the Newbar chamber in your hand. So the first question, what it is, you are happy, you will answer, ma'am, sir, it is Newbar's chamber. The second question, the use of it, you will say it is used for calculating RBC and WBC. The third, you are very happy, you have answered second question also. The third question is how you do it, tell me the procedure. तो वहां तुम लोग अटक जाते हो, you don't know the procedure, how you calculate RBC and WBC by using a Newbar's chamber. तो how तुम लोग अच्छे से आंसर नहीं कर पाते हो. तो व्हाट इज द फॉर्मूला, अगर हाउ बता भी दिया प्रोसीजर तो फोर्थ क्वेश्चन एग्जामिनर का आएगा, व्हाट इज द फॉर्मूला, व्हाट इज द फॉर्मूला फॉर कैलकुलेटिंग आरबीसी, व्हाट इज द फॉर्मूला फॉर कैलकुलेटिंग डब्ल्यूबीसी. सो ये भी बता दिया तो उसके बाद फिफ्थ क्वेश्चन जाएगा अनीमियाज और ल्यूकेमियाज पे. सो देयर इज अ स्टेप बाय स्टेप वाइवा. यू नो न्यूबार्स देख के तुम्हारे हाथ में अनीमिया ल्यूकेमिया क्वेश्चन नहीं पूछेंगे, पहले पूछेंगे व्हाट इट इज, what is the use of it is. So he uses RBC WBC count. So how you do it, tell me the procedure. Okay, what is the formula? Okay, RBC count कम हो जाए तो disease is known as anemia, तो anemia का classification और कुछ भी क्वेश्चन आगे रहेगा. Okay, WBC count ज्यादा हो जाए तो it is leukemia, तो ल्यूकेमिया का क्लासिफिकेशन और उसके आगे कुछ भी क्वेश्चन जा सकता है. तो अनीमिया और ल्यूकेमिया पे पूरा वाइवा आगे, बहुत अच्छा तुमने वाइवा दिया तो वहां तक भी यू कैन एक्सटेंड योर वाइवा टिल दैट पॉइंट. तो वाइवा इज नेवर एंडिंग ना, तब जब तक तुम आंसर करोगे तब तक इट विल लॉन्ग. So जहां तुमने आंसर करना रोका वहां पे it will stop and the examiner can move to the second topic, another topic. So it is up to you that how your viva, to give viva is an art, right? So you should be saying तुम्हारा अगला क्वेश्चन तुम्हारे लास्ट आंसर से बनता है. So तुम्हारे आंसर में you should use those words that you are aware कि अगले क्वेश्चन में मैं I am able to answer these. So this is how the Viva goes on, right? So what you are saying? Okay. Okay, so yeah, Rohan, definitely you are a NEET PG aspirant, but in this class I am teaching you the, for university exams, the instruments and the spotters. So you are most welcome to attend this also. And immediately after this lecture, in the next 20 minutes, I am having another lecture for NEET PG aspirants. I hope some technical error was there. Am I visible, audible now? Let me confirm. If it is there, I will continue. Okay, I hope it is working. Okay, I'm sorry for getting disconnected due to some technical error. I just got disconnected. Due to some technical error, I just got disconnected. So I hope it is working now and we should continue. Okay. So yeah, let me confirm if visibility is great. The camera is working. I will go ahead. Okay.